Good afternoon, everyone. Welcome to this month's AFPHM webinar. Today we have Dr. Tony Gill presenting on advanced training in public health medicine. A reminder to all participants to please submit your questions in the Q&A box. These will be answered at the end of the presentation by Dr. Tony Gill. I'll now hand it over to Tony for his presentation. Thank you.
Thanks, Terence, and welcome to all of the advanced trainees who are taking part. For those who don't know me, I'm just recently transferred from being chair of the Faculty Training Committee and I'm now chair of the Faculty Education Committee. And what the intent of today's webinar is to take you through the advanced training and the requirements and emphasising a few areas where we know issues arise while trainees are taking part in advanced training. So what I'll do is I'll cover the training program, a bit of an overview, a little more about learning contracts, learning contract reports, and a lot about assessment. And I'll also be providing some prerequisites for the exam, the requirements for those who are contemplating sitting the oral examination this year, and some requirements for that. Probably just a couple of things first. There are some key people to deal with. As most of you probably have had contact with Anusha in the training, who looks after training, and also she's a first contact for assessment. There's a separate email for examinations for those who are contemplating the oral examination this year. And the further person involved has been involved in National Training Days, although she just happens to be on leave for the next 3 weeks. Others are covering her, is Rachel Smith, who works in the faculty office dealing the broader public health issues as distinct from training and education. So just want to, I suppose, re-emphasise a couple of things in this, that public health medicine is advanced training program only. We don't have basic trainees, and obviously, as you all know, there's no requirement to do the basic physician training. And we're certainly trying to ensure everything that remains like that. Also stressing that really this program is about adult learning, and the fact that you all are individually responsible for your own training. It might be saying a bit of, teaching grandmother to suck eggs, but I think it's just worth reminding people that, in advanced training, you do have the responsibility. And I think all the information I'm providing in these slides is either in the Advanced Training in Public Health Medicine Handbook, or it's on the RACP website, other than a few reinforcements of a couple of issues which I've been asked to bring up, especially around assessments. So my reference for everything is that Advanced Training in Public Health Medicine Handbook. So as you're probably all aware, we do have a public health training curriculum and competencies, and it covers a broad range of areas in the domains of general professional practice, cultural competency, information research and evaluation, policy, health promotion, disease prevention, health sector advocacy, development and management. And they're the broad areas that we cover in the curriculum and in the competencies. Probably the other one is, what is the core training requirements? So the training is a time-based one, so it's both sort of time and some competency requirements, or in the way of assessment requirements. So there is obviously 36 units, with each unit being a full-time equivalent month, and the content covers the advanced training curriculum and also the more generalised RACP professional qualities curriculum. There is a requirement for supervision, and for every period of training, there's a requirement for the trainee to have a supervisor with a fellowship in public health medicine, but noting that some workplaces, the workplace supervisor may not have a fellowship. In those circumstances, there must be a co-supervisor who does have a fellowship. I mean, the reasoning behind that is obviously you have a workplace supervisor who supervises the actual work you're doing, but they won't, if they're not involved, not a fellow, they won't necessarily understand the requirements of the public health training program and be able to give advice and feedback around public health, the public health training factors and where you're going with the training and what opportunities you might be able to get to cover some of the assessments without having a better understanding of the whole training program. And so there's no expectation that workplace supervisors are going to have the same detailed knowledge that hopefully the AFPHM co-supervisor will have. The other requirement we have, which is fairly unique in the college, is to have a mentor. And the mentor also has to be a AFPHM unless special dispensation occurs in the Faculty Education Committee. And that's probably only occurred once or twice in the last 4 or 5 years from my experience. So there are various teaching and learning requirements. So per year, there must be a minimum of at least one learning contract, and obviously a learning contract report following that training period. National training days, which are coming up in June, is recommended but not compulsory. And there are also these trainee video conferences, again recommended and not compulsory. The one thing I do want to really remind people is that to actually be involved in the advanced training program for the time, you must be in an accredited public health medicine training position. So if you're not in an accredited position, then the training time you do in that position will not be counted as part of the 36 units or 36 full-time equivalent months. And I just need to reinforce that because a few people have got caught out either at the start of their training, when they've commenced training, or when they've moved positions to suddenly not be aware whether their position's accredited. There is a list on the college website which shows all the accredited training positions in public health medicine. So certainly if you're contemplating doing a position for training, then you need to ensure that the supervisor of that future position submits an accreditation application for accreditation for that position for the time to be. So when you start in that position, your time can be accounted. And so I think that's just is a significant reminder because I know some people have, unfortunately, been caught out in those circumstances. And we can't sort of retrospectively say, well, just because it's accredited now, it's accredited previously for your time. So I've got a few slides here about the application, the training requirements, or the requirements for eligibility for entry. You're in the training program, so it's not necessarily relevant, but I'm sure that people might speak to you about what do I need to do to gain entry, and because I work alongside you or whatever, or people you just otherwise know. So it's really just to reinforce to all of you so you're aware of it, so people do ask you questions. So the eligibility to enter training is you need general medical registration. An issue that has occasionally come up is where people have conditions on their registration. It's not a very common, it's fairly rare, but the issue of that is that any conditions on someone's registration should not prevent them undertaking the training positions they're in. You need to be at least 3 years postgraduate medical experience, and of those 3 years of postgraduate, at least 2 of them, those years have to be face-to-face clinical experience. I.e. seeing patients face-to-face. You need to have completed an MPH or equivalent, and of those there can be, because there are various people who do slightly different, some have done MAEs, some have done other diplomas of tropical medicine, masters in tropical medicine rather than public health, but need to have completed an MPH or equivalent. As well, you need to be eligible to commence training, be appointed to an accredited public health training position. A point I reiterated just before about being an accredited position. And a position needs to remain accredited while you're in it. I think if people do inquire of you, because you're sometimes the best people for our future trainees, is they need to think ahead about joining and submitting forms to be processed and for all the eligibility to be done. So the application to commence training must be submitted in 4 weeks of commencing a position, obviously that goes back to the time when you started the position. There are a few other ones for potential trainees. That MPH courses must be assessed courses, and it must satisfy the 5 core areas of which my brain will go into. Things is obvious, and there's one other, health promotion. Noting that if you do not, some of you might have been through the process and they're the core areas. Luckily my brain was working around health protection, health promotion, health policy. Well, that's really, and some of you when you came in to the training program might have been able to come in having not done some of those core areas, but that now is tightened up to ensure that everyone who starts has covered the core areas. Previously you could enter before that and have not, and then have to undertake the core areas during your first year of training. That was changed, and the reason for that was we don't want people, once they've started training, spending all their time actually doing the MPH subjects to get their MPH. It would be it's not appropriate for someone who hasn't done the epidemiology or biostats health protection to suddenly be working in, say, a communicable disease unit and not actually having any theoretical background behind it. The other issue, is just as a fact, is that by having the MPH requirements in the 3 years postgraduate, we are having advanced trainees who do not need to do basic physician training. So we managed to not require basic physician training. That's one of the reasons we can do that. So in the training program, obviously the aim of the training program is for trainees to get experience across public health medicine, appropriately supervised and supported environments. It's delivered through the workplace, so it's on the job training, and the content's defined by the learning objectives outlined in the public health curriculum. One of the things probably to reiterate is that trainees should seek a range of training opportunities. It would be rare for a trainee to be in the same position for three full-time equivalent years of training and get access to a broad range of competencies. And therefore, during your training program, you should seek opportunities. And these can vary from rotations, and sometimes that occurs in some areas. There are a number of positions you can rotate through, like's occurred through some of the STP processes, might occur through secondments. So, for instance, we've had people from where I work here at the TGA spending 6 months or 12 months in ACT health, or the people might get short-term secondments to pick up other competencies, or varied employment posts. So moving to different employment positions through your training to enable you to get a broad range of opportunities and experience and access to the broad range of competencies. So a couple of the issues that are raised on a regular basis one of them is about overseas training. So you're allowed to do 12 units of training overseas. And we've certainly had a number of trainees who've done periods of overseas training, some from very diverse, from working in a WHO office to working in Ebola treatment to areas like another types of areas. But these must be approved prior to you commencing the units of training. One of these issues about when you do overseas training is that while you're doing the overseas training, you do require an AFPHM co-supervisor, even if you're working in a public health unit, a public health sort of position overseas. The reasoning for that is that an AFPHM fellow will understand what the actual training program is here and be able to interact. Very similar to where we have a co-supervisor in Australia who's a fellow and can advise on the specific aspects. It's also important too to make sure that if you're training overseas, any of the issues which might be overseas country specific, there might be some discussions with the AFPHM co-supervisor about how that might apply in Australia and some discussions around that. But you do need to complete at least 2 years of training in Australia or New Zealand. So just to re-emphasise that. I suppose I'll re-emphasise also the prospective approval required from the Faculty Training Committee. Some other people undertake a PhD study while they're doing their advanced training, and you can include a maximum of 12 months of PhD-related activity in the training program. Again, that must be prospectively approved by assessing the relevance, and PhD obviously needs to be relevant to the AFPHM competency areas. If you do a PhD, 12 months of a PhD overseas, that'll count as your 12 months overseas time as well and can't be done additionally. So no double dipping on those circumstances. Mentioned early on, and I know a number of people have joined us since the start, that unlike the rest of the college, we have a formal mentor program. We do recommend a mentor for the whole training program, although there is no reason why you can't change mentors during the training program. The mentor must be a fellow, unless special dispensation is given by the Faculty Education Committee. And the aim of the mentor is to provide some oversight of progress as you move jobs and change supervisors. So to really have an ongoing point of contact who has better understanding and can provide independent guidance on matters relating to training, trainee wellbeing, aspects of career development, and could also get involved if a trainee and a supervisor have a relationship which is not going as well as one would want. I think what people, if they've got a mentor, should probably look at people maybe in areas of where they have an interest, or, and if possible, maybe somebody who is in the same location. But noting trainees might move around within states or territories or between states and territories. There's no need to change your mentor if you move around, but you can if you wish. But I think the main aim of the mentor is trying to provide oversight and progress, help you as a person to sort of see where you're going. And that's also a reason why they have to also sign off on your learning contracts and learning contract reports. So they at least they'll have an understanding of what you're planning to do in a training position or what you have actually done in the training position. So supervisors, so you need a supervisor for each training position. And the aim of the supervisor is to support trainees in planning and facilitating your learning path. So that obviously starts from when you start in a position and discussions around the learning contract. So facilitation should support you in facilitation of effective teaching and learning opportunities that might occur in the workplace. provide comprehensive and timely feedback on your progress in achieving the competencies, involved in determining your readiness for some summative assessments, and obviously oversee completion of the learning contract report and signing those off, and providing an assessment of your competency level at the end of that period of training. So learning contracts, I know can be seen as the bane of one's existence. However, it's actually a process we've had in place for a number of years, quite a number of years, and it was actually based originally on a similar thing used in the New South Wales Public Health Training Program. I think the reminder is it's written by you with your supervisor and intends to look over what are you actually going to do during this period of training. So a period of training might be 3 months, it might be 12 months, but it's a chance to plan ahead what competencies you may wish to try and achieve, what activities you're going to do, and what it really does by sort of forces you to, it's sort of to force a learning plan of what you're going to try and achieve over that period of training. And obviously you've got descriptions about roles, your activities and projects, and down to potentially what competencies you hope to achieve during that period. I know a lot of the time it's sometimes seen as a chore, but I think it should be taken really as an opportunity to think ahead of what you're going to do. For those who probably have only now done their first or whatever, it may be a daunting task, but hopefully as you proceed, then you'll realise that there is some significant use in using a learning contract to sort of think ahead of what you might do and then work out and then plan while you're actually doing that period of training to achieve the outcomes that are there. The one comment around that is there's always a question about when do I need to do a new learning contract. It really is when there's a significant difference in the work you're going to do. Might mean you've actually moved to a different position in that training period you're going to be in before. It might be a completely different role to what you were doing before. But I think it's really an opportunity. It doesn't need to change just because you do a slightly different project or one project doesn't go ahead. It doesn't mean you need to do a new learning contract for that period. So what we do here is that we're linking activities to competencies expected to achieve. And there are a number of common problems that what we see when the regional education coordinators have the task of reviewing your learning contracts can be people cutting and pasting competency lists or just writing numbers, not linking competency-specific activities, not really describing what your role will be in, say, in a project. It's really for you to emphasise in the learning contract and obviously in the learning contract report what you actually are planning to do, not just what the team's doing. So that the team you're with might have a project, but you might have a particular role, and that's really what you should be describing under that project, what you're actually doing, what activities you're going to be undertaking. Now, I've written the spreadsheet now about this should be, and I hadn't quite checked the minutiae because it's been developed and was going to be put on the website. A spreadsheet which has been created by Rob Hall, the South Australian REC, which lists all the competency and is a nice way to actually keep a better record. As those of you who've tried now to have done learning contract reports, you have got that rather complex table at the end of the learning contract report, which I don't think there's a way you can print out in any way without taking up probably half the significant amounts of many tables. So this is a spreadsheet which, when you enter your competencies and soon when you do your report, actually is colour-coded. So if you actually achieved a competency, you get a green, it goes green. One of the things about this spreadsheet is that it's also a useful thing for once you've done your first learning contract report, you can then use that as a more easier way to sit down with your supervisor to see what competencies you've had before and what you want to cover and what you plan to take. Because you should be speaking with your supervisor and understanding what you've already done to know what do you actually want to try and achieve in this. And discussion with the supervisor in writing the learning contract might produce projects which can cover those competencies or ways you can do that. Bit of an administrative one, noting that learning contracts need to be in within 4 weeks. There is a fee, and I'd be remiss not to actually let you know about that. But that's just a reminder to do it. So I think the only thing really to emphasise is that you should be doing your learning contract really in the first week or so, sitting down with your supervisor and then producing a learning contract and then for signature. If you do have a problem, say with your mentor being away or whatever, what I would recommend you do is you submit it without, say, the mentor's signature, and in those cases, with a note to say what the issue is, and then follow up when the mentor signs it off to get it within the 4-week deadline. The same thing really applies for the 6 weeks in the learning contract report, because I know there may be times when somebody is actually away, in which case it's very difficult to get them to sign it. So moving on to learning contract report. So you've had your learning contract, you've done this period of training, and you've now reached the end of that period of training. The aim of the report is to summarise what activities and projects you actually did, which may be exactly the same as your learning contract, but it might actually include a number of other activities which were not planned to be done and might have come up. I mean, for instance, there might have been a disease outbreak, which wasn't an expectation you were going to do, and you've suddenly been put online, sort of offline, to go and do a project to say about a disease outbreak or some other activity. So you're actually detailing the outcomes of your activities and how they link to the learning objectives. The other issue is your learning contract obviously reflects your full-time equivalent for that period. And you can see there, if you want to make any changes regarding, if you're going from a full-time, one full-time sort of training to half-time, or going from half-time to a greater amount or a lesser amount, then you're required to submit an amended learning contract with a cover letter detailing why this has changed. So your learning contract report includes a retrospective account of roles, activities and projects, outputs from the projects which demonstrate your competencies. You can also say what training and conferences you've attended. And there's also a part for reflection on the training period by both the trainee and the supervisor. Noting that, in fact, on the learning contract report, you put down what level of competency you believe you've achieved against the different competencies, and the supervisor will put their view of that as well. And if they differ from your room, they should be putting some comments into the learning contract report to why they believe your level of competency against a particular competency is different to what you assessed yourself as. Hopefully it's because they think you actually did better rather than worse at that competency. So once you've attained the required level of competency, you do not have to repeat it on subsequent learning contracts. The only thing I'll flag is you just need to make sure that when you write about your activities on future learning contracts, you don't sort of end up with a one line because you only got a few competencies to do. You still need to explain what you're doing. And as I mentioned, the new spreadsheet, which hopefully is available on the website, is there to assist in the recording of your competencies for the learning contract report and then for future ones. Again, that's sort of covered whether you change project activities, you must outline the LCR what changed, and signed by your supervisor and mentor before submission. And there are late submissions as well. Excuse me. I'll now go through the work-based or learning and assessment tools that you need to do over the full period of training. So there's requirement to do 3 direct observation and practical professional skills, 1 formative oral presentation assessment, 2 summative oral presentation assessments, 3 professional qualities reflections. Workplace reports is 2 or 3, and I've got a slide, there's a slide following explaining the difference. For trainees who commence training in the beginning of 2017 onwards, there's a requirement to do a research project. And there's also the oral examination as part of the assessment. So going through them in the DOPPS, so it's an opportunity for trainees to receive practice and feedback on practical skills. 3 are required to be submitted during your full training. It's recommended you should do 1 per year, and really it's recommended you should try and spread all your assessment and learning tools over the whole period of training rather than suddenly finding out closer to the exam time that you really have got a whole lot to do while you're trying to think of other things like actually study for the exam. DOPPS was originally based on clinical training, but what we've done is have made in the public health setting, is really looked at other types of work which would be suitable to have this assessment done. And this can be, as I'm mentioning in the slide, chairing a meeting or speaking at a community forum, conducting environmental audit, site inspection. They're all sort of public health related activities where direct observation of your professional skills can be done. And it's up to you to identify these in discussion with your supervisor. The oral presentations. So there's a requirement of a formative assessment. So that's read done over the course of training. And the background to the oral presentation really is that from a public health perspective, we need to be able to communicate. It's really one of the strong requirements for public health physicians to be able to actually stand up and speak to people, including members of the public. And as those who are considering the oral exam, I mean, one of the questions they always have is a lay question where we ask an epidemiology question and have to explain some various epidemiology terms potentially to members of the public, which may seem easy but isn't. It's hard to, and it's like anything in medicine, trying to take, we're using lots of medical terms, having to re-communicate it in simple language. So the oral presentation assessment is at least 10 minutes long, delivered by a trainee to an audience, assessed by 2 fellows. During these assessments, both the formative and summative assessments, we are not actually assessing the content, but it's really how you go about presenting your slides. And there's a marking guide which talks about what you need to do. The only time when there might be an assessment of content is if you're actually doing a Jerry Murphy presentation, which uses the same assessment and can be used as an oral presentation assessment, where then the content is also assessed. There's required to do 2 summative presentations, and again, that's recommended completed in each of the 2nd or 3rd year. Again, no different. But I suppose the one comment that wasn't for the summative ones, the assessors should not include your supervisor. If you can, so you might need to plan activities or see about activities when you can actually get 2 fellows to be assessors. And if you have trouble, speak to your supervisor, or necessarily there might be opportunities if it's to speak to the regional education coordinator to see if there are any other fellows who maybe can be involved in doing an assessment. Professional qualities reflections to help you articulate and formalise ideas and insights. And again, with these 3 must be submitted over the course of training. Workplace reports. So for those trainees commencing training before 2017, there was a requirement to do 3 workplace reports over the course of training. For the all trainees who commenced training in 2017, the requirements for 2 workplace reports and 1 research project over the course of training. But there is an exception to that. So, for instance, some people have requested, and you've got to do it for an RPL for various reasons within the first 3 months of commencing training, have wanted an RPL for their research project. If that's granted, you still need to do 3 workplace reports during training. And it's recommended you spread them out and try and do 1 per year. And I've made the comment there, don't leave till just before the oral examination. It is not unknown for trainees, when they realise what the requirement to sit the oral examination is, and I'll come to that later, suddenly find they've got to quickly get some workplace reports in and reach a satisfactory standard before they can sit the examination. And if you're getting close to an exam, you don't want to spend your time writing workplace reports when you might prefer to be studying. So the oral examination, I suppose this, I won't go into any of the details of the actual examination. There'll be, for those who are planning to sit the examination, there'll be other activities on closer to that time, which we take you through what the format of the exam is. But I think just a reminder, so this is for eligibility, and seeing we're now only a few months out from when people might be looking at applying to do the exam this year. The eligibility requirements is general medical registration, the same as you need to start as a trainee. You need to have completed at least 29 units of training by the 1st of December of the year during the examination, which, just to rephrase that, is if you're planning to sit the exam this year, you must have completed at least 29 units of training by the 1st of December this year. So that's a requirement to actually be eligible to sit. You have to pay a fee, you have to have your learning contract reports up to date, and you must have paid all your other college training fees. It's worth noting that there is a maximum of 3 attempts at the oral examination. So, for the other assessments eligibility, by July 31st of the year you're sitting, so for those who are sitting this year, you need to have achieved all of this in the next 2 and a bit months. You must have completed 1 formative oral presentation, 2 DOPPS and 2 PQRs. You also must have completed one summative oral presentation, and 2 workplace reports must have passed. And note that there are timelines I'll come to later, which means you probably, if you haven't got your workplace reports in already, you're unlikely to be able to get them assessed in time, depending on the time frame. So important dates: all learning contracts within 4 weeks training, all learning contract reports within 6 weeks of completing. There are the timings for the workplace reports. Hopefully there's very few are trying to put a second workplace report for their submission for getting by 31 July, noting there's going to be time to assess. But having said that, if people have got their second workplace report going in, it would be worthwhile flagging when you submit it that whether you're going to be applying to do the exam, because then they can be prioritised to ensure they're done in time. And then there's a 3rd workplace report submission time. So the important latest dates for the oral examination this year: by 31 July, you need to have completed all the requirements to be eligible. Applications open 12th of August and close 23rd. The current planned dates for the exam is the 29 to 30 October, and if it's a supplementary one, it'll be on the 30th or 31st. And the results will be released back to the candidates on the 21st of November. So that gives you what the current planning guideline is for this year's oral examination for those of you who are planning to sit. Just a few notes: late application not accepted. You'll then be required to pay and be confirmed back to you. Just flagged, there's a number of other education policies around the college, which you can have a look at. There's progression through training, flexible training, on academic honesty and plagiarism, accreditation, PQRs, recognition of prior learning, although most of you probably now are beyond the time when you can apply for recognition of prior learning. So that's a bit of a quick surge through. As mentioned previously, nearly all the information there, other than a few of the remarks, are actually in the handbook, which is available on the website, and the other policies are available on the website. So what I'll do now then is, when I can find the ones, I can see we've got 15 questions, and I'll read, as you don't see them, I'll read them, start from the start. So I think the first one was a question about if you're seeking an overseas placement during training, it's likely there won't be a FAFM present, can ever supervise from Australia or working overseas. I know it was asked early, and I think I covered that, but just as a reminder, you will have a supervisor who may be the equivalent of a FAFM in country, but there is a requirement when you're doing overseas placement that you have an Australian co-supervisor FAFM to do those. So that should give you an answer to that question. The next question I have is, given the requirement of accredited positions, is there any update on how changes to STP funding may affect future training positions? Does RACP, AFPHM have a view on how to support the longevity of the public health workforce given these recent changes? All right, so at this stage, there's a review of some of the currently STP funded positions. This is in line with a requirement from the Commonwealth Department of Health, who provides the funding to the college. With this review, the Commonwealth has really asked for focuses on these training positions to be either in private sector or more rural or remote, rather than capital cities. There are a number of public health training ones, predominantly in Sydney, which are under this review. But at this stage, we don't know the outcome of these reviews and where it would go. Certainly the supervisors of the training positions which are potentially affected for next year are certainly been involved back with the college for the review of these positions. If you know, the STP funding is spread across across all specialties, and the college manages all those for the RACP. And so if there is a decrease in public health funded, then it would affect those positions funded through the STP program. It might mean that in some workplaces, rather than being funded by STP, the workplace might decide to just fund it as a position. So the longevity of public health workforce, and it's still probably only, I'm not sure the number actually is, but it's probably only less than half our trainees would be in STP funded positions. The others are all in positions they work in and use them for training. So I think there's some more discussion to go on that. So moving on to the next question. How long would you recommend to plan for prospective approval for an overseas placement? Is it more than 6 months? I don't think there's a time, but you probably need time for it to be, 6 months should easily be enough to achieve that. I think you should probably have some discussions if you're looking at that with your regional education coordinator around it. But yeah, it's really that planning, but I think as long as you plan well ahead to get all the approvals in. I mean, it's certainly the sooner the better around that. But I know there have been a few times where we've had some shorter times when people, for instance, deploy to deal with Ebola and things like that. So I would certainly shouldn't be more than 3 months, 6 months. But I would suggest it's a minimum of 3 months planning to try and to make sure it's not rushed in any way. So moving on to the next question. trying to see how this works on my end. So, so where have we got the next one? Terence, anything? I'll just go down in order. So the question was, how does the faculty help guide trainees with filling and finding accredited work? Very distant to other colleges. Found it difficult to find a post. Yep. I suppose we do differ significantly from the other colleges in that people find positions and use them for training. In some cases, they are public health sort of units would apply and ask and for the training, for people for the training position. But otherwise, it's a matter of, because we're not based in the clinical and go through those processes, it's a matter of finding a job which might be useful for accreditation. I know sometimes organisations which have jobs they want to advertise are putting them up on the through the college web or occasionally out through RECs around those positions. So it's not quite the same as a lot of other areas, but there's not, so I suppose we would help guide by saying here are vacant positions around the country we're aware of, and otherwise it's probably finding positions. So it's, again, it's very different to say the clinical hospital. The next one, which I know is a very relevant one, which is around, has there been auditing the average time it takes to look at learning contracts, learning contract reports back to trainees? I haven't been chair of the Faculty Training Committee. I am aware that we have not, at times it has taken far longer to get your learning contracts back to you, far too long in some cases. We have had a change of some RECs around, and I also know from a discussion only with 2 members of the committee last week that certainly the RECs have all emphasised, and it was certainly the Faculty Training Committee I was at earlier in the emphasised of to be more timely in getting these learning contracts and learning contracts reviewed. So yes, it has not been optimum, but the aim is to improve that time. So the time has been too long in a number of cases. The learning contracts, next one, learning contract submission to an online portal. I think there is an intent to get to that, but that at this stage is reliant on the college's IT system, and that is certainly that part. We do keep trying to amend the template, and certainly one of the things is around the spreadsheet to assist it. I know it's a question about where we have the location. I don't know. I need to confirm back that with Anusha, and I'll get Anusha to probably send something out to all trainees. So what I'll probably get her to do is, if we can't have it on a location on the site at the moment, I'll see if we can actually send the spreadsheet out to trainees direct as for that. I think that'll help a lot of you as you go through various learning contracts. Going on to the next question. All the different forms of trainees are all over the place. Word docs, different places, version of the portal, now spreadsheets. Oh, in one place, okay. I'll take that one on notice and pass to Anusha. If Terence, we can probably grab some of that question and see what they can do. One of the issues we also have is some of the actual forms are not in the portal because some people need to access some of the forms, don't actually have access. The only people who have access to portals, for instance, are current supervisors to the training portal. People who actually are training supervisors are supervisors of trainees who are currently in training. So some of the forms actually exist elsewhere to provide it. But hopefully there aren't too many different versions on that. So thank you for raising that, and we'll look into it. The next question is one about time frame for learning contracts. As I mentioned, certainly the learning contracts, learning contract reports, the training committee is working hard on it. And workplace reports, they're certainly working on the assessment, continue to work on the assessment, people who assess it, to try and maximise it or minimise the time for it to be marked. Noting that for some of those, we need the fellows to be available at the time to look at some of those. That's timely manner. All of you have received, I believe, an email about registration for the National Training Days. The issue I know for trainees is the cost. That has been an ongoing issue for a number of years. It's one of those situations where a number of years ago, probably there was some actual funding provided, but the college tightened up all its procedures, and the ability for the college to subsidise, and the faculty has actually asked the college, up through the college, to subsidise, have not received favourable comments. So what it now is that any session needs to be covered by a cost recovery for it. And that's why it can't be covered by annual fees. So after I heard about, I hadn't seen the registration going out, but it was raised in an email to me last night, and I've inquired back over the college. And so the current fee of 105 costs a small amount of staff costs, but mainly it covers the catering for the 2 days, and some food catering for also speakers who may be there over that time. Has actually been sponsorship raised, and that actually brought the cost down. So in fact, the cost of 105 is actually exactly the same as last year. We've been able to keep it at that. It's been stretched as far as possible from the information I've received back from the college this afternoon. So with sponsorship, it's brought the level down by about $50, potentially for $50, by $50 down. Probably to give perspective that it was probably looking at closer to $150 without sponsorship, but there are some comparable meetings. I mean, AFPHM do a comparable meeting, $145 for 2 days. AFPHM's a much greater one, but there's a few other activities around it. I'm sorry I don't have any better news around the costing of the National Training Days than that. But I can tell you the cost of National Training Days has been raised and worked on numerous times through Faculty Council, and both Linda Selby, the current president, and Lynn Madden, the previous president, have really been pushing hard to work out how we can get more support from the college for this. But unfortunately, that's the situation it's in. So, next question is around, given the public health training doesn't necessarily follow the format of the annual clinical year in January, why is there a limitation on sitting the examination based on units of training completed? Seems to penalise mid-year commencement. Are there alternative options available? Effectively mean trainees who commence mid-year need to take an extra year of training. The issue, I think, is that if you've completed 29 units by the 1st of December, you then will finish if you're working full-time, you finish it probably by mid the following year. I don't think I'm not aware of any aim to alter that requirement. But I think the main one around is actually to ensure that people have done enough training. What 29 is nearly just short of 2.5 years of full-time training, and that's believed to be an appropriate time. There is the start of a curriculum renewal program across advanced training, which will look at all parts of training, including assessment. And that's going far more to a time and competency-based one. So this might actually be an issue, and I'll get Terence to probably email me separately this information, because what we'll do is we'll put this into the discussions around the renewal of curriculum about the number of, what the limitation is on the sitting, on the number of units training completed before sitting the exam. So I'll take that one on notice. Another question was on the workplace report slide, is that you can submit a report 1, 2, 3 at any of those times, or is the first and the first thing? No, you can report, you can put 2 reports in at the same time. You can put all 3 reports in at the same time. So you can do as many as you like, you know, but they're the time frames during the year where they're sort of, I suppose, put through as a group of actual reports to then be processed. So that's the reason we do that. Where do we go? Oh, went too far, I think. I've covered ST. Another question about ST position, I think I've covered. There's a question about I gave an update on STP previously. Why has there been no formal communication? Well, at the moment, there's certainly been discussion at both Faculty Education Committee, amongst the Faculty Council. But at this stage, because this is all under review, there's nothing to go out with at this stage. And that, I think, that'll be something we looked at once the review of the STP positions is completed. So the next one, I think, is one that comes up quite often, is reports, outputs, and public health often don't fit the standard workplace report structure, e.g. having methods section. Why don't they allow for a wider range of workplace outputs to suit public health training? Could some examples that have passed be available? All right. Well, it's been recognised that a number of the reports or outputs or things which might be done in the workplace report, including journal articles, won't necessarily fit the structure. What people should do is put a covering document and cover those areas in it. Because if you're actually doing a report or an output, there will be a method, you will use some form of method to achieve it. So what you can do is you can attach an extra document covering those aspects under the workplace, the standard sort of workplace report structure, to cover those areas not covered actually in, say, you produced a report. Because a lot of the time you won't necessarily have the same areas. So you can use the report, but add on a document covering those other areas which haven't been done. So the question around timeframes of learning contracts, why is there an associated financial penalty for training delays but not for the colleges, given the high administration and training fees we already pay? For those who don't know, the assessment of learning contracts is actually done by fellows who don't get paid, unfortunately, for it. It's all pro bono work. And yes, as I said earlier, there have been some timeframes which have been far too long, but we're working on doing that. But I suppose there's the actual people who do the review learning contract reports are actually the fellows, the RECs on the Faculty Training Committee, and they fit that in. So those, on those areas. Question again, learning contracts, really saying what's going to be done differently. Are RECs really the only limiting factor? Well, they are, because in fact, once they're in, they then provide us of every month to the REC. So the limiting factor about getting learning contract reports, from my experience, is actually just getting the RECs all to get them done. And noting that, you know, we'll have depending on the time of the year, beginning of a year, we might have sort of 80 or 90 learning contracts needing assessment. and be looked at. Do a breakdown of what our training fees go to. Unfortunately, I'm not aware of any breakdown around those. They mainly go into the administrative costs of running all the college and its activities. I don't think there's a breakdown anywhere on those areas. But I mean, as you'd imagine, though, there's a lot of staffing costs and other administrative costs just processing all the applications, all the training fees. But we don't actually have a general breakdown of where they go. So there's another question here about National Training Days. Is it just for catering? I can't confirm that. And then there was a comment made about, well, maybe you could do BYO, but I mean, I think we don't actually have I don't have an answer on that exactly, but I think most of it is, so a significant amount would be catering, but there'll be some to cover some staff costs and some potential speaker costs. I mean, that mainly is their catering. And there was a question here about, have you thought about making learning contracts based on the theme of the competency instead of the specific competency to make them efficient for everyone? Trying to get my head around that. One of the ones we'll be doing we will be reviewing all the competencies and the process and the curriculum renewal work that's going on. And that's happening over the next few years. And that's going to change how we describe competencies, and it brings in a whole lot of things called entrusted physician activities, which will be sort of around how things are done. So there's a whole lot of work going, but can't, based on the theme of the competency instead of specific competency. I suppose you're listing a lot of the level of the competencies. They're not, and you're actually describing a theme of what you're doing in your activities part, I would have thought, as part of that. That seems, I think I've now gone through all the questions I've got here, unless there's anything else, Terence?
I had a question emailed to me. For recognition of prior learning, are we able to claim 3 months of clinical work?
Okay. You can, I'd have to just review it exactly what the recognition of prior learning. I mean, there's two things. You can't get recognition for prior learning for an activity which was part of the prerequisite to be eligible. So that's one part. And you can certainly do clinical time. An aspect, a percentage of your training time can be clinical work. That would have to be taken on notice around the RP, about the full requirements about RPI. I certainly couldn't give an answer straight off on that.
Well, thank you so much, Dr. Gill, and that concludes this month's AFPHM webinar. Thank you to everyone for joining us today, and we hope to see you next time.
Well, thank you all for attending.